Hello, good evening everybody. Dzień dobry. Witamy. Bardzo prosimy tylko o potwierdzenie, czy już nas słychać. Może nasz dział techniczny potwierdzić, czy nas słychać. Szanowni Państwo, dzień dobry, witamy Państwa po raz 50. To już 50 tygodni z Państwem, jest to już naprawdę duży. Dzisiaj z nami generalnie mamy dwóch gości. Będziemy sobie rozmawiać, moi drodzy, o szczepieniach na COVID-19. Zarówno ja, jak i wielu z Was już pewnie znalazło swoje miejsce w punktach, gdzie będzie wykonywało szczepienia. Dlatego postanowiliśmy jeszcze raz, po raz kolejny dzisiaj o tym opowiedzieć, zrobić taki fajny brief podsumowujący, co jest najważniejsze z punktu widzenia farmaceuty. Ja tylko przypomnę, że generalnie jesteśmy już z Wami od 50 tygodni na trzech kanałach, na kanale YouTube, na kanale College oraz na tym kanale, który widzicie na Facebooku. Moi drodzy, dzisiaj porozmawiamy sobie, podsumujemy sobie całość generalnie, co wiemy o COVID-19, ale również o tym generalnie, w jaki sposób prawidłowo podawać te szczepionki, co z punktu widzenia farmaceutów, którzy będziemy to wykonywać za chwilę, albo już wykonujemy, bo wiem, że duża część z Was już, że tak powiem, to robi. Będziemy razem wspólnie dzisiaj po kolei, prawda, jeszcze raz jakby przechodzili przez całość od naszych kolegów ekspertów z zagranicy. Webinar będzie po angielsku, więc ja skończę już po polsku. Dziękuję Wam oczywiście za uwagę dzisiaj. Już przekazuję za chwilę już mikrofon do naszych kolegów. Hello everybody, my name is Peter and today we are going to present you a short webinar about how to basically perform the COVID-19 vaccination. I know that many of you basically are already in the vaccination centers providing the COVID-19 vaccines, but we thought basically it would be nice to get a very nice summary from our friends from Canada. Today with us Alex Wong and Kevin Chang, who are pharmacists from CHIO. And this webinar, we'd like to thank Regis Weilandcourt for having his employees here with us to just tell us about how it should be properly done. Necessary because all of us are already in the process. So Kevin, Alex, I'm giving you the microphone. Regis, thank you very much for having us.
Can you see our slides? Great.
Yes.
Okay. So, good evening, everybody. So, I'm Alex. I'm just going to do the introduction, and then Kevin will get started. So, me and Kevin are both pharmacists at the Children's Hospital of Eastern Ontario in Canada. We've done a whole lot of immunizations, including COVID immunizations. So, we're just here to give you basically a COVID immunization training 101 to get you guys started in the COVID clinics in Poland. So I'm going to go through some learning objectives. So today we're going to discuss the 4 new COVID-19 vaccines as well as the differences between them. We will review how to store them as well as handling and disposal. We'll describe the proper injection technique, how to select your needle, including the gauge and the length, describing how to assess your patient's COVID-19 vaccine eligibility, and also discussing monitoring and adverse effect management. Okay, so let's get started. Just put a pointer on here. Okay, so I'll go over the mRNA COVID-19 vaccines first. You may have heard about these. These came out in like early January. Basically, there are 2 on the market right now. There's the BNT162b2 mRNA COVID-19 vaccine from Pfizer, and then there's the mRNA 1273 SARS-CoV-2 vaccine from Moderna. Now, these vaccines are lipid nanoparticle encapsulated mRNA-based vaccines that encode for the SARS-CoV-2 full-length spike protein. So basically, how they work is there's this lipid nanoparticle, and there's mRNA encapsulated inside of it. And basically, the lipid nanoparticle helps with the getting into the cell. And then from there on, this mRNA is translated into these spike proteins, which essentially allows for our cells to recognize it and elicit immune response, adding to protection. So this chart just kind of goes over the 2 vaccines and the differences between the 2.
The Pfizer-BioNTech vaccine is currently indicated for patients 16 years and older, whereas the Moderna vaccine is indicated for patients 18 years and older. The dose is slightly different. The Pfizer-BioNTech is 0.3 mLs, whereas the Moderna vaccine is 0.5 mLs. The scheduling is slightly different too. So typically, the Pfizer-BioNTech is 2 doses that are given 21 days apart, whereas the Moderna is 2 doses 28 days apart. Here in Canada, what we're doing at the moment, or at least Ontario, is we're doing them 4 months apart for a lot of patients to see how that goes as well, kind of due to a shortage in the vaccine. So in terms of the route of administration, they are both given intramuscularly. The primary storage requirements are pretty similar. However, there is a bit of a difference in the temperatures that they're stored at. So the Pfizer-BioNTech is stored at -80 to -60 degrees Celsius, whereas the Moderna vaccine is stored at -25 to -15 degrees Celsius. In terms of storage requirements pre-puncture, so after you take it out of the freezer, the Pfizer vaccine is good for up to 5 days at 2 to 8 degrees Celsius and or up to 2 hours at 25 degrees Celsius, whereas the Moderna vaccine is good for 30 days at 2 to 8 degrees Celsius and 12 hours at 8 to 25 degrees Celsius. The Pfizer vaccine does require a diluent. It's 1.8 milliliters of normal saline, whereas the Moderna vaccine does not. Their usage limit post-puncture is the same at 6 hours at 2 to 25 degrees Celsius. And the Pfizer vaccine is available in a multi-dose vial of 5 doses, whereas the Moderna vaccine is available in a multi-dose vial of 10 doses. These are just the side effects of the vaccines here. Pretty typical of what you would expect from a vaccination. So injection site pain, fatigue, headache, myalgias, chills, joint pain, and fever. It's pretty typical of what you would expect. So these are what you would see after the first dose here, okay? In terms of contraindications to the mRNA COVID-19 vaccines, basically these vaccines are contraindicated in any individuals who are hypersensitive to the active substance or ingredient in the formulation. So again, a big one to pay attention to here is the polyethylene glycol. So a patient with polyethylene glycol allergy cannot have this vaccine. Another one to keep in mind is Moderna has something called tromethamine in it. Tromethamine is a salt that's formulated with a couple of medications such as ketorolac, fosfomycin, carbapenem, or dinapros. So if a patient has an allergy to one of these medications, it could be that they have a cross allergy to the salt, and therefore they would be contraindicated in these patients as well. In terms of preparation, the Pfizer-BioNTech COVID-19 vaccine is a little bit more complicated than the Moderna vaccine. Essentially, it's just the dilution portion that makes it a little bit more complicated to do. But you would remove a thawed vial of the Pfizer vaccine from the refrigerator, allowing it to come to room temperature. If the vial is frozen, you'll allow it to thaw for 30 minutes at room temperature. And these vials at room temperature must be diluted within 2 hours. Now, before dilution, you'll want to gently invert the vial 10 times, making sure that you don't shake it. And then you'll obtain 1.8 mils of 0.9% sodium chloride for injection. You'll cleanse the vial stopper with a single-use antiseptic swab and add your 1.8 mils of your Pro-Thrombotic sodium chloride injection into the COVID-19 vaccine using a needle that is 21 gauge or narrower. Then you'll want to make sure that you equalize the pressure before removing the needle from the vial by withdrawing 1.8 mLs of air into the empty diluent syringe as shown here. Afterwards, you'll make sure that you once again gently invert your vial 10 times to mix it, and then record the time of date of dilution in the label, storing the vaccine between 2 and 25 degrees Celsius and discarding any unused vaccines 6 hours after dilution. Afterwards, to obtain your dose, you'll use aseptic technique, of course, cleansing your vial stopper with a single-use antiseptic swab, and then withdrawing 0.3 mLs of the Pfizer-BioNTech vaccine, administering it immediately and no later than 6 hours after dilution. So the Moderna vaccine is a little bit easier to do as it becomes pre-diluted. You'll thaw this vaccine in refrigerated conditions for 2 hours and 30 minutes, allowing each vial to stand at room temperature for 15 minutes before administering. Alternatively, you can also thaw at room temperature between 15 to 25 degrees Celsius for 1 hour, making sure that you do not refreeze the vials after thawing. And again, no reconstitution or dilution is required. You'll then swirl the vial gently after thawing it between each withdrawal, making sure you're not shaking it because these vaccines are very delicate. And then using aseptic technique, you'll clean the vial stopper with a single-use antiseptic swab and withdraw 0.5 mLs of the vaccine from the vial using a new sterile needle and syringe for each injection, making sure that the dose in the syringe is being used promptly. Now, in terms of transportation of the mRNA COVID-19 vaccines, I just mentioned that they're very delicate. So basically, Pfizer recommends that their vaccine be shipped in a frozen state as per the product monograph. However, sometimes this isn't feasible. Sometimes we have public health clinics where we administer vaccines. So the vaccine may be transported beyond the initial point of delivery. It's recommended that the vaccine is packaged for delivery in a frozen state and transported to the clinic or facility location using an insulated cooler that has been preconditioned to a refrigerated temperature of 2 to 8 degrees. The vaccine should not be in transport for more than 8 hours, and open or reconstituted vials should not be transported. And essentially, these products should be sent just in time as part of a planned vaccination clinic. So our next set of vaccines are non-replicating viral vector COVID-19 vaccines. So essentially how these work is they use a modified version of a different virus or vector to deliver these genes that encode for these SARS-CoV-2 spike proteins in host cells. The vector virus that they use is a type of adenovirus that has been modified to prevent replication. Once inside the cells, these SARS-CoV-2 spike protein genes are transcribed into mRNA and translated into proteins, which they're expressed by the cell. So it's actually pretty similar to the mRNA vaccines after this. And then it will elicit an immune response and again, add to protection. So the AstraZeneca COVID-19 vaccine is a monovalent vaccine composed of a single recombinant replication deficient chimpanzee adenovirus vector encoding the S glycoprotein of SARS-CoV-2. It's available in multi-dose vials of 8 doses and 10 doses and indicated for patients 18 years of age and older. And this is a 2-dose series given 28 days apart. In terms of storage and stability, you want to make sure that you store these unopened vials in the refrigerator from 2 to 8 degrees Celsius. And then after the vial has been punctured, it's good for 6 hours at room temperature or 48 hours in the refrigerator. In terms of contraindications, individuals who are basically any individuals who are hypersensitive to the active substance or any ingredient in the formulation is contraindicated. And then here are your non-medicinal ingredients here. A big one to pay attention to is polysorbate 80, as this is found in a lot of cleaning products as well. So any allergy to this would be contraindicated for the patient. In terms of administration, again, there's no reconstitution required. The product monograph doesn't mention any mixing or anything like that either. You just essentially just take a sterile needle and syringe to extract your 0.5 ml from the multi-dose vial and administer this intramuscularly. Again, these are our side effects from the AstraZeneca COVID-19 vaccine. Pretty typical of what we'd expect from a local reaction standpoint with pain, tenderness, redness, warmth, itch, swelling, and induration. In terms of systemic adverse events, again, things that we typically expect, such as fever, chills, joint and muscle pains, fatigue, headache, nausea, and vomiting. So you may have heard of some blood clots in the news from the AstraZeneca vaccine, and this is called Vaccine-Induced Pro-Thrombotic Immune Thrombocytopenia, or VPIT. Essentially, these are rare cases of serious blood clots that have been associated with thrombocytopenia and have been recently reported following post-licensure use of the AstraZeneca COVID-19 vaccine, primarily occurring in women under the age of 55 years and occurring 4 to 16 days post-vaccination. The reaction is kind of similar to that of heparin-induced thrombocytopenia, or HIT. It's associated with the development of antibodies that kind of activate these platelets, stimulating the formation of clots. So anyone who receives the AstraZeneca vaccine should be informed of this potential adverse effect and be advised to seek medical attention if they develop symptoms of thromboembolism and or thrombocytopenia between 4 and 20 days post-vaccination. So some symptoms you can include to counsel to your patients are shortness of breath, chest pain, leg swelling, persistent abdominal pain, neurological symptoms such as severe worsening headaches or blurred vision, or skin bruising other than at the vaccination site. Next, we have our Janssen COVID-19 vaccine from Johnson & Johnson. This is again a monovalent vaccine composed of a single recombinant replication incompetent human adenovirus type 26 vector that encodes for the SARS-CoV-2 spike protein. It's indicated for the active immunization for the prevention of COVID-19 caused by SARS-CoV-2 in individuals who are 18 years or older. However, this is a single dose versus the 2-dose series of the AstraZeneca vaccine. And again, it's contraindicated in any individuals who are hypersensitive to the active ingredient, any other adenovirus-based vaccines, or to any ingredient in the formulation, including any non-medicinal ingredient or component of the container. So in terms of storage and stability, it's available in a multi-dose vial containing 5 doses of 0.5 mLs. It's stored in the refrigerator at 2 to 8 degrees until it's expired. After the vial has been punctured, it's good up to 6 hours refrigerated and up to 3 hours at room temperature up to 25 degrees Celsius. Again, there's no reconstitution required. However, before administering a dose, you'll want to carefully mix the contents of the vial by gently swirling the vial in an upright position for 10 seconds, making sure not to shake the vial. We'll then use a sterile needle and syringe to extract 0.5 mLs from the multi-dose vial and administer this intramuscularly. So here are your ingredients again. Again, a big one to look out for is polysorbate 80, again found in a lot of cleaning products, so just something to keep in mind as well. And then here are your adverse reactions associated with the Johnson & Johnson vaccine. Again, very similar to what we saw with the AstraZeneca vaccine and all the other Pfizer and Moderna vaccines for your local reactions as well as your systemic reactions as well. And then this chart kind of just highlights the similarities and the differences between the two adenovirus vector vaccines here. So the biggest difference is that the schedule is 2 doses 28 days apart for the AstraZeneca vaccine, whereas it was a single dose for the Janssen vaccine. The storage requirements post-puncture are slightly different. The AstraZeneca vaccine is good up to 48 hours refrigerated and 6 hours at room temperature, whereas the Janssen vaccine is good up to 6 hours refrigerated and 3 hours at room temperature. And then the multi-dose vials are slightly different as well. So when you're giving your vaccinations for your COVID-19 vaccines, you of course want to be wearing the proper PPE. Our friend here is decked out in his face shield and goggles like these. He has a face mask on as well, making sure that he has 1 pair of clean non-sterile gloves, which are technically optional. He's making sure that he's wiping his vial and everything else with alcohol, wiping the injection site with alcohol and allowing it to dry as well, and as using proper technique in reconstitution and withdrawal to prevent any sort of contamination. He's also using a separate sterile needle and syringe for each injection and making sure that he's disposing these syringes in a special container designed for sharps as well. And then we'll move on to the injection workshop and I'll hand things over to Alex.
All right. So just a few tips here when you are basically getting the patient ready to vaccinate. So when you're booking the appointment, you want to make sure to remind the patient to wear clothes that will facilitate access to the arm. So, no tight clothing. You need to be able to access the upper arm, the upper deltoid. So a t-shirt works great. A muscle shirt works great. If they have a sweater they can remove, that also works out great. You also want to make sure that the patient has enough time to be monitored after the vaccine. So 15 minutes is the standard time, 30 minutes if they have previously had a reaction. Remember to introduce yourself as the pharmacist. I feel like that's just a nice touch. It tells the patient that pharmacists can be immunizers and they can do other things than just count pills as they think we do. And you want to prepare the vaccine and give the injection out of sight of the patient. So try to make them look away. You can also use distraction techniques for both adults and children just to make sure they're not focusing on the needle, because then they can get a little bit nervous. Another tip is when you're booking, at the time of the first appointment, a tip is to book the appointment for the second dose at that time so that you're not worrying about if they're going to have their second dose. So when you're assessing the patient, you want to assess them for how they're feeling today. You want to make sure they're not feeling ill today or in the past few days. If they are feeling ill, I'll talk about that in a few slides. I think it might be the next slide. You want to assess for any medical conditions, medication use. If they're pregnant, you also want to evaluate if they've had their first shot. You want to evaluate if they've had a reaction to their first COVID vaccine. And so in patients who have had a severe reaction to the COVID shot, it is not recommended. And for mild to moderate reactions, you want to refer the patient to a doctor, an allergist, or an immunologist to get the okay from them. And it's strongly recommended that you document what discussions have been had regarding the patient's vaccination. Allergies here, I just mentioned a few, so PEG, tromethamine, or polysorbate, like Kevin mentioned. You also want to make sure that they haven't received any vaccines in the past 2 weeks. So if they have, then you want to defer until it's been 2 weeks. If they're pregnant, immunosuppressed, or have an autoimmune condition, this is a precaution. It is not a contraindication. This is a conversation that the individual, the patient, needs to have with their healthcare provider before proceeding. And again, strongly recommend to have some documentation. If they have any bleeding disorders, you want to make sure that it's optimally managed before vaccinating. And if they are on anticoagulation, in these patients, the vaccine should be offered. And I've included a link here where I've gathered all this data from. So if you want to look into more detail about what to do if these patients have any of these conditions. So if the patient's not feeling well, so whether that be a fever or they have any sort of infectious symptoms, you want to defer the vaccine and you want to refer them to get a COVID test. And you want to wait at least 3 days or 72 hours after the negative test before attempting the immunization, just in case they're pre-symptomatic. So like Kevin mentioned, the gloves are optional. Depending on your jurisdiction, depending on where you're practicing, they may make you wear gloves. I generally do not, but if you do use gloves, nitrile gloves are preferred because of the latex allergies that people can have. Before continuing, make sure you have the right drug, the right dose, the right patient, the right route, the right reason, the right time, and the right documentation. Now you're ready to inject. So you've assessed the patient, you've decided that you are going to give the vaccine today. Here's just a brief overview of the anatomy of the needle and the syringe. And this is not exactly the COVID shot, but very similar. This was my setup for the influenza vaccine. So you want to have 2 needles, one to dilute the vaccine if needed, and another one that will go in the patient's arm. You want to have a 1 cc syringe or a 1 milliliter syringe. The doses are quite low, so 0.3, 0.5 mLs. You want to get a syringe that isn't too big so you can measure accurately. You want to use some swabs. So, for example, if they come in a multi-use vial, you need to swab the vial before withdrawing the vaccine from the vial, and you need another swab to disinfect the arm or the injection site. A cotton ball or gauze just for any bleeding afterwards, if that happens, and a bandage just to patch everything up and make it nice and clean. And of course, you need your vaccine in here, which I don't have pictured. So to select your needle, generally you want to go with something like a 23 or 25 gauge. And just a reminder, the higher the gauge, the thinner the needle. And depending on how large the individual is, if they're generally under 60 kilograms, you want to use a 16 millimeter needle. Most people, you will use a 25 millimeter needle. And in some rare instances, if the patient is obese, then you want to use a 38 millimeter needle. So I want to briefly discuss about the syringes with low and high dead space. So on the right here, we recommend that you try to get a low dead space syringe, and the reason for that is, so assume that the red part is the COVID vaccine that's been diluted or not, depending on which one you have. This will help to minimize waste and also will help you to get as many doses as you can compared to something with a high dead space where if you push the plunger fully, it doesn't push all of the vaccine out. So, there's some loss in here. So in Canada, Pfizer originally had a 5-use multi-use vial, but then they changed it to 6, and it's only possible to get that 6th dose with a low dead space syringe. Otherwise, there's too much loss in the syringe, and you are unable to get that 5th dose. So just it's not recommended, it's not mandatory, but it is recommended to get a low dead space syringe to maximize the number of doses. And this is more so with the Pfizer vaccine because we have to reconstitute it. So to withdraw the vaccine, you have to make sure the vaccine is thawed appropriately and that you've allowed enough time for the vaccine to be thawed. And you refer to the monograph for the thaw time, the specific thaw times. Wipe the surface of the vial with alcohol, let it dry, and remember that it's the drying that kills bacteria, kills organisms. So make sure you let it dry before poking the the vial. You're going to pull back the plunger empty to inject air into the vial. And you have to remember that Pfizer has an additional step to reconstitute the vaccine. So remember to reconstitute the Pfizer vaccine before you withdraw it in the needle. And then once you withdraw, double check your volume. You can also have another individual double check your volume to make sure that everything is what it should be. Just a reminder, we are measuring not at the tip of the plunger, but at the first line. So make sure we're measuring correctly with the needle so we get the full dose that's been indicated. So tips to eliminate air bubbles. So with the mRNA vaccines especially, we want to be extremely careful because they are very, very fragile. Like Kevin said, there's a lipid nanoparticle that surrounds the mRNA component. And if you drop, if you tap or shake the vaccine, the mRNA vaccines, then it goes to waste. So make sure you don't drop it, you don't tap it like you would a normal vaccine. And this is only applicable to the mRNA vaccines. The AstraZeneca and the Janssen vaccine, you can do what you do normally, but we have to handle the mRNA vaccines with care. I think you have mostly Pfizer in Poland, so you want to make sure that when you're pulling the vaccine, when you're withdrawing the vaccine from the vial, that you go very, very slowly and you try to minimize any bubbles. So these steps here that I've outlined, or the tips that I've outlined for AstraZeneca and Janssen, you are not applicable to the COVID, the mRNA vaccines. And this is a checklist that we have here from our provincial government, provincial pharmacy association, pardon me. And you can also use this just to make sure that everything, you're doing everything step by step and you're doing it in order and you're not missing any steps. So, like don't put the syringe on the counter, for example, or, if you do, make sure the counter is clean. You can also just like open the needle. Usually our needles come in packages, so I tend to leave the needle inside the package until I'm ready to go, just to minimize any contact with the outside world, if that makes sense. So you can follow these checklists. And this is actually the checklist used for our injection certification. So, if you do all of these, then you're probably fine to proceed. I also want to briefly discuss SIRVA, or shoulder injury related to vaccine administration. And this is caused by incorrect technique or landmarking for intramuscular deltoid injection. So this happens when you inject the vaccine into the shoulder joint as opposed to the muscle. And it can cause some inflammation, and then subsequently it damages the bursa, tendons, and ligaments of the shoulder joint. The key here to identifying SIRVA is that the symptoms typically begin within 48 hours of the vaccine, and they don't improve over time with over-the-counter analgesics. So it's important to for patients to know what to look for, and it's important for pharmacists to tell them what to do in case those symptoms come up. Because we definitely want to treat this, because without treatment, the symptoms can last for months and may never resolve. So we want to make sure we're treating patients adequately for this. So when you're ready to vaccinate, you want to make sure that the patient is seated. This is generally recommended in case the patient faints. So if they're seated, there's no catching. You don't have to bear the whole weight of the patient, as opposed to if they were standing and they collapse, then you have to carry the whole weight. But if they're sitting, you just need to make sure they're not falling off the chair, basically. So make sure they're sitting upright, arm to the side, relaxed. It should not be resting on anything. It should just be hanging to the side. Position yourself as a pharmacist on the patient's side of the arm that you're injecting. So if you're doing left arm, you'll be sitting on the left side of the patient. And make sure you don't reach across the patient. This is just good practice. 3.3 and 0.4 go hand in hand, really. So to make sure we're injecting at the appropriate site, you can use 2 to 3 finger widths below the acromion process. This is the bony protrusion at the shoulder joint. And if you use 2 or 3 fingers, depending on how large your fingers are, that will get you low enough where you need to inject the vaccine. And I just put a $2 coin here just to show how large the area is. And you want to inject right in the middle of the $2 coin. So just a few more tips. So if they're right-handed, you want to give the vaccine in the left arm generally, but ultimately it's the patient's choice. They can do what they want. You want to locate the area on the deltoid with the 2 or 3 fingers below the acromion process. Clean the skin with an alcohol swab and make sure you allow it to dry. When you inject, quickly inject it at a 90-degree angle all the way to the hub. So the hub is this little gray part here. It's a little small, but basically the needle goes all the way in until the hub stops you. And you want to do it like a dart motion. So like at bars they play darts. So you don't want to go slowly. You want to quickly inject so that you avoid dimpling like this. So I put a big do not do this. And then you will depress the plunger at about 0.1 ml per second. So if it's a 0.3 ml vaccine like Pfizer, it takes about 3 seconds. Of course, you can go a little bit quicker, but you don't want to do too quickly. You have to find that right balance between not too quick and not too slow. Because the longer the time the needle is in the arm, the longer it hurts. Well, you also want to give yourself enough time to inject the vaccine at a reasonable rate. Then you'll quickly remove the vaccine at the same angle, 90 degrees. Apply some pressure with a cotton ball or gauze. Then you will activate the needle's safety mechanism if available, immediately after injecting, just to prevent any needle stick injuries. You will dispose the vaccine in a safe container, typically a Sharps container. And then you're done. You can bandage the patient and you can send them off to the waiting room for monitoring for 15 or 30 minutes. So sometimes you may encounter patients with tattoos on their arm, or they may have a scar, or what if you hit the bone with the needle? These are all okay scenarios. A tattoo is not a contraindication to getting a vaccine. If you can, I would recommend that you try to go give the vaccine in an area where there's no ink, but if needed, you can go straight through the tattoo. You also want to make if ever the patient has a scar on their arm and it's right in the area where you need to inject, then you can go through scar tissue, but if you can avoid the scar tissue, then that is better. And this last point, sometimes for thinner patients or patients who don't have that much subcutaneous tissue, you may hit the bone with the needle. This is not painful to the patient. In fact, most patients don't even realize this is happening. So if ever you hit something hard, you probably hit the bone, in which case you just have to pull back the needle just ever so slightly so that you're back into the muscle, and then you can inject at that point. So the adverse effects for the vaccine, the most common ones are soreness, redness, or swelling, headache, fever, nausea are also reported. Muscle aches, and also flu-like illness, which generally lasts maybe under 24 hours, sometimes a little bit more, but it's quite short-lived. And of course, we've all been hearing about the very rare side effects of the COVID vaccine. So myocarditis, there's been reports of that. It's not so clear if this is the cause, if it's caused by COVID vaccines, but I just put this data here for completeness sake. Kevin talked about thrombosis. Currently, it's estimated about 8 cases per 1 million vaccines, so quite rare. And also, there's also been reports of Bell's palsy. So these are all things that, they are side effects. You want to make sure that the patient understands the risks and benefits. And if they're not entirely sure if they should get the vaccine, they should have this discussion with the family, with their doctor, with their physician. Afterwards, you want to monitor the patient, and you want to tell them to notify you if they feel unwell. So they should always be supervised. The patient must remain in the pharmacy for 15 minutes with a responsible adult or a nurse that can monitor them. And again, for patients who have previously had a reaction, we want to monitor them for at least 30 minutes before leaving the pharmacy. Of course, documentation is important. We want to document the name, the time and date of the vaccine. In the case of the COVID vaccines, it's intramuscular, left or right arm, and of course the vaccine lot and expiry. So the expiries are very important because they're only good for 6 hours after reconstitution. So we want to make sure that we are giving the vaccine before those expire. And I will hand it back to Kevin to discuss anaphylaxis.
Okay, so I'm just going to quickly go over anaphylaxis here. It's something that you may have to experience one time when giving immunizations, but essentially these are a severe, life-threatening systemic hypersensitivity reaction involving 2 or more systems or the respiratory tract. This can be fatal if untreated, and anaphylaxis, again, has been proven to be causally associated with vaccines. Anaphylaxis is preventable in many cases and is treatable in all. So the signs and symptoms develop over several minutes, which is why we have our patients sit in the pharmacy for about 15 minutes. The typical features of anaphylaxis are an itchy urticarial rash, progressive and painless swelling around the face and mouth called angioedema, sudden reduced blood pressure. You can also find sneezing, coughing, wheezing, trouble breathing, upper airway swelling possibly caused by an airway obstruction, as well as crampy abdominal pain and vomiting. So in terms of assessing your patients, most reactions will again occur within 30 minutes after injection. You don't want to ignore mild symptoms such as rash or itchiness because these can quickly escalate into a systemic response. And to manage anaphylaxis, you'll want to assess their ABCs or their airway, breathing, and circulation. Assess the patient for any angioedema. Ensuring someone calls for help, so basically calling for an ambulance or paramedic, making sure that the patient is never left unattended. And if they aren't edematists, you should place them in a recumbent position with their lower extremities elevated to maximize perfusion to the vital organs. Now, in terms of treatment, epinephrine is the most important in its first line. It should be administered as soon as anaphylaxis is recognized to prevent any life-threatening symptoms from progressing. Epinephrine is available in pre-filled syringes, such as the EpiPen, as shown here, or in ampules of 1 mg per mil. Basically, how epinephrine works is it binds to alpha and beta receptors.
Yeah. I have a question. Sorry to interrupt. I have a question. What about like if the patient is wearing clothes? Should the clothes be removed and
right into the clothes?
I'm just asking because this is very interesting part. And should it be removed, or we can just go through the trousers or whatever?
You can just go right into the clothes. You don't have to remove anything.
Okay, so you just do a shot.
Exactly. No need to waste time, right?
Thank you very much.
So yeah, it binds to your alpha beta receptors, stimulating your sympathetic nervous system to relax your medial smooth muscles and increase blood vessel constriction.
Yeah. We need to just put the presentation because I think it's gone now. Jarek?
We're good to go.
Oh, thank you.
Good. So the recommended dose of epinephrine is for patients of any age is 0.01 mg per kg with a max of 5 milligrams per dose. To avoid delays, typically infants and children under 30 kilograms will be given 0.15 milligrams by the auto-injector or the EpiPen Junior, or 0.15 mLs of the 1 mg per ml solution, whereas patients over 30 kilograms can be given 0.3 milligrams by the auto-injector or 0.3 mLs of the 1 mg per ml solution. These doses may be repeated at 15 to 15-minute intervals if necessary for a total of 3 doses. And even if you administer epinephrine, you want to make sure that you call emergency services as soon as possible. Now, the IM or intramuscular injection is preferred in all ages. The preferred site is the anterior lateral side of the thigh, which is shown here. Again, as I just mentioned, if clothing cannot be removed, epinephrine can be given through the clothing. Next, I'll just go over some vasovagal reactions. So this is essentially just the patient fainting. The signs and symptoms are It's typically a rapid onset. The patient goes from normal to unconscious within seconds of getting their injection. They may appear pale and show this pseudo-clonic seizure activity, and they will collapse as well. So you want to make sure that your patient is lying down with their feet elevated. There's always a risk of head injury, so you want to make sure that you assist them to the floor slowly, and you may apply cold compress to their neck or face and check their blood pressure. You want to make sure that the client sits for a few minutes when they wake up and before standing up. And if you have a client who has a history of fainting, it's recommended that they are immunized lying down to prevent any falling or collapse. And that concludes our presentation today. The biggest takeaway, I mean, I get this question all the time, but it's like, which vaccine is the best for me? Typically, what I would say is the vaccine that you can get into your arm the fastest is the best vaccine. I mean, there's a lot of data out there, and and people may say like, hey, Pfizer is like 95%. Versus AstraZeneca is like 65% efficacious. Well, you have to keep in mind that these trials were done at different times during the pandemic, and there was no head-to-head trials. So really, it's best that everyone just gets immunized at this point. But other than that, I'll just open the floor up to any questions before Alex and I go.
Okay, I think I have a question. So if we could just come back to the anaphylactic shock, basically. So this is just for summary. We don't take the trousers down. We just do it through the trousers. This is the most important.
Yeah, that's you don't want to waste time, right? Because
don't waste the time. Yeah, it's. I think that this reaction needs to like very fast reaction from the person who is providing the vaccine. This is definitely for sure. Another thing, what for me is very important. How often did you have a chance to use this needle for the big needle for people who are like a bit bigger? It doesn't happen very often, does it?
I don't think I've ever done it.
Okay.
Yeah. I've used smaller needles for smaller patients, but I've never used the big.
Excellent. Another thing about like this mixing. So basically, when we do the Pfizer vaccine or Moderna, am I right? We don't do shaking like that. We just do it.
Yeah, I believe the Moderna vaccine you just swirl, whereas the Pfizer vaccine they recommend you invert it.
But yeah, you don't want to do this for sure because again, it's very fragile and you don't want to disrupt or destroy anything.
Yeah,
you want to make sure that you're doing it with care.
About Pfizer vaccines and AstraZeneca. Pfizer vaccine basically requires 2 doses. So first dose basically, and then how many days the second one should be administered? Is it for up to 42? Yeah.
It's recommended 21, but we've been doing it up to 2 months here in Canada. So
what is recommended in Canada?
Well, we're doing it up to 4 months here between the
4 months. Okay, so the first one is okay. It's up to 4 weeks because for me it was a month. I had like 3rd of January and then in February. Yeah. Okay. I think it's anything else about the side effects. I mean, in general, it's the most typical ones are the fever, joint pain, and this is like typical.
Yeah, typical things that you'd expect for your immune response to be there. You know,
nothing else.
Generally feeling unwell. That's about it.
I'm thinking if there are any other questions because I think it's very brief. I mean, I really like it. So it's an excellent job, guys. Thank you very much. Yeah, and Katarzyna wrote us that thank you very much for a compact presentation. It's going to be in use. Thank you very much. Same for me. Excellent. So I think we had a very good presentation. If there are any questions, please ask them now because we have like 2 minutes. If not, guys, thank you very much for this. So Poland is starting to do vaccinations. I mean, some of the pharmacies already started. The next part basically is just on the go. So fingers crossed for us here.
Wow, that's sure it'll be.
So thank you very much for our host, Polska Grupa Farmaceutyczna. Also, thank you very much to Regis Weiland-Court for helping us with this presentation. Obviously, thank you very much, Alex and Kevin, for everything and all our projects regarding to vaccines. I mean, it wouldn't be without you. So thank you so much. Yeah.
Thanks.
Great embracing change. Thank you very much, and goodbye, and see you soon.
Yeah, see you soon.
Thanks.
Thank you.
Bye.